Welcome, everyone, and thank you for joining episode 1 of our Children's Law Center Coronavirus Community Conversations. I am so grateful for the outpouring of concern that I've heard from our allies and supporters about the welfare of our children and families. This is our first ever virtual event, and it may be your first as well. So before I say anything more, I'm going to turn things over to my colleague, Hannah Casper-Johnson, to go through some housekeeping details.
Thank you, Judith. So just some quick notes for you all. First of all, as much as we would love to be able to see everyone's faces today, in order to maximize the quality of this video, we are asking that everybody keep their volume turned off and their audio on mute. Additionally, I would suggest selecting the speaker view setting at the top right corner of your screen so that you can best follow along with Judith and her presentation. Secondly, we'll be having a Q&A today, and I would encourage you to share questions or comments with me at any time through the chat feature, which can be brought up by clicking the chat icon at the bottom of your screen. Lastly, please note that we are recording this event. Without further ado, I would like to turn it back to Judith Sandalow, our Executive Director here at Children's Law Center.
Thank you, Hannah. I'd like to take all of you back to the good old days, which is February 2020, and let me orient you to how our families and our children were doing back then. Back in February, we had about 30,000 children in DC living in poverty. That's living a family of 4 on an income of only $24,000 a year. Half of those kids were living in extreme poverty. Family of 4 living on $12,000 a year. Because of the rising cost of housing and because of poverty, there were about 22,000 children living in crowded housing. That means maybe 2 or 3 families living in one apartment, or a family couch surfing and moving from home to home. The schools reported that they knew of 5,000 children who were homeless. And of course, poverty and homelessness aren't the only problems facing children and their well-being. As well, there's learning and health issues. We had 13,000 children in DC who were already receiving special education services. And our children's mental health system was in crisis already. It took 3 months to see a child psychiatrist almost, even when a child was in crisis. I think it would be fair to say that many of our children and their families were managing to keep their boat afloat only through sheer grit and ingenuity. And of course, they could rely on the outcome-oriented advocacy skills, very effective advocacy skills of my colleagues at Children's Law Center, who are working to give them stability through safe families, good health, and quality education. Then the tsunami hit. Let's start in March. Even though it's only been about 7 or 8 weeks since the US began to take the pandemic seriously, I feel like we're already in phase 3. For Children's Law Center, phase 1 began very early in March when we began to plan for the disruption. But we moved into high gear on March 12th when we told our staff that we were going to move to remote work. If you can remember back to those very first few weeks, there were changes and updates and new information every day and sometimes every hour. During that very first week, as you may remember, the schools had closed and kids were on spring break. The court was issuing new orders every single day. What part of the court was open? How could you file pleadings? In the first week, we spent a lot of our time working to make sure that our kids and families had access to the court, but didn't have to show up, that they could stay safely at home and participate by phone. And actually, we wanted our lawyers to be able to do that as well. The mayor didn't issue her stay-at-home order until May 30th, so that was another couple of weeks. And during that time, we were fighting for our foster kids to be able to visit safely with their birth parents. So you may know that when a child enters foster care, they still have a close relationship with their brothers and sisters. They've been separated from them, separated from their birth parents, and we work hard to help those kids stay connected to their birth families to reduce the trauma of going into foster care. But the Child Welfare Agency in DC was not using public health data in order to make those visits safe. So we spent a lot of time trying to make sure those visits happened in the park, where we didn't have to risk the birth family or the foster family being exposed to the coronavirus. I will say we never did win the policy fight, but we were successful in keeping every single one of our kids safe and being able to have a safe visit. We also spent that first week contacting every single kid and every single family that we work with. First of all, to figure out how are we going to stay in touch with you during this shutdown while we're working remotely? Do they want to be texted? Do they have phones? Did they want email? Could they use FaceTime? I'm sure there are technologies that we're using that I don't even know about. And as we had those conversations, here's what we were thinking about. Could we talk with that child on FaceTime and be sure there wasn't an adult lurking in the background who was listening in on the conversation and influencing it? So we began to talk with kids and families about how to be able to have confidential conversations. And we did a safety assessment. Some of our kids are at risk of being trafficked. They're living in very high stress situations with a parent who might currently have some mental health issues. So we wanted to figure out who are our highest risk kids, and those are the kids that we're still going to visit in person even now. Although we try and limit those visits, we want to keep eyes on those kids. As we had those conversations, we discovered that many of our families and definitely our kids are not connected to mainstream media. So they didn't know the specifics about how to keep themselves safe from the coronavirus, what social distancing was. And so frankly, in the first week or two, we were counseling parents and kids, and especially teenagers, about what it meant to stay safe and to stay home and to make that possible for them. The truth is that the closing of the schools, as important as it was and as necessary as it is, created a lot of dangers for our kids. Hunger being the first and most important danger. Most of our kids get breakfast and lunch at school, and there were a lot who were having dinner in their after-school programs. So immediately we began to hear from parents that they didn't have enough money to feed their kids. They also were finding that when they went shopping for food, because all of us were trying to buy in bulk, that most of the generic brands, which our families rely on, had been sold out. So they were having to spend more money on name brands and their dollars were not going as far. Now, in our families, the lack of food makes all of the dominoes fall. If you have to take money to spend on food, that money can't go somewhere else. We had, for example, a child living in foster care with his older sister, an adult sister. And the sister said, I don't have enough money to feed him and I may not be able to keep him. We were able to get grocery cards so that that family can stay together and that little boy doesn't have to go into foster care with strangers. Another situation, we had a 20-year-old who was doing everything in his power to age out of foster care with a job, but one of his barriers was that he had a traffic ticket that he had to pay off in order to get a background check to get the job with Uber Eats that he was planning on. Once everything shut down, he began to think that he would need to spend his scarce savings on food. And if he did that, he would never be able to get his background check and get a job. We were able to get him groceries, and therefore he has been able to pay off his fine. Means that when the pandemic is over, he'll be able to have a job. And that's very important because he has no family to rely on when he turns 21 and ages out of foster care. So those are just a few of the ways in which hunger plays a role. Let me talk about health. A lot of our parents flagged very quickly that their apartments weren't safe for kids. There were rats, mice, roaches, mold. I know that many of you have heard me talk a lot about the substandard housing that our families live in. Parents used to feel good that their kids could spend 10 hours a day at school in a safer environment. But now that kids were stuck at home, many of our families were very concerned about the health impact of being in those apartments 24 hours a day. We have kids with autism and mental health problems who are suddenly without their schedules and their supports, beginning to have behavior challenges that parents were worried about. And then you know that the bus lines shut down and our parents can't afford Uber. They certainly don't have cars. And then of course, most of them have lost their jobs now that the city is shut down. I will say that for those of you who've heard me preach about the psychology of scarcity or read Dr. Shafir's book by the same name, you know what it means when somebody is overwhelmed with too many problems that they can't actually focus and solve them. So I think of our staff as really being like the COOs for parents or the chiefs of staff. One of the things that we were doing was helping to break down all of those problems into small chunks, solve them, and then really help parents get to what they all told us they wanted to focus on, but were having a hard time thinking about, which was how are they going to educate their kids when their kids weren't in school. If you have children, then you probably know how inconsistent schools have been at communicating with parents. I know my granddaughter goes to a local school, and I didn't hear from her teacher for 3 weeks. So some of our parents were being contacted, other ones had no idea what was going on. And we were able to bridge that gap for them and at least let them know that they could go pick up school learning packets at schools. However, we've got an awful lot of kids with health problems and parents and grandparents with health problems. So they were understandably unwilling to risk their children's health or their own health by traveling to school. And because we're a city with so many charter schools, we've got a lot of folks who are traveling across town to school. With the bus lines shut down, they couldn't get to school. So we spent a fair amount of time helping folks get their learning packets. And if they couldn't get them, to get the school to deliver them. Sorry, I have to stop and take a look at my notes. There's an awful lot that's going on for our kids, and I want to make sure I don't forget anything. Obviously, one of the biggest problems for all families is a lack of internet capacity, and our families don't have the money for every child in the family to have a technological device, whether it's a phone or a tablet. So that was one of the problems that we were finding. During this time, we spent every available dollar we could find on grocery gift cards, or actually buying groceries and delivering them to families. We arranged to have learning packets dropped off by schools, as I mentioned. The other issue that a lot of our families faced was medication. So they couldn't get renewals of medication because the doctor's offices were closed down. We helped them transition to telemedicine to cut through some of the Medicaid red tape so that they could get medicine delivered. And at the same time that we were doing all of that for our individual kids and families, our policy team was advocating for some of the emergency legislation, the new government policies that we knew our families would need. So let me just tell you about a few of them. We, with our allies, successfully advocated for DCPS to provide a tablet to every child who needs one. We worked with the council to get legislation to remove barriers to graduation so that kids don't have to do 100 hours of community service in order to graduate. We obviously very concerned that we would have high school seniors whose futures would be derailed by not being able to graduate. One of the most important things we did was draft and get the council to pass emergency legislation to ensure that foster youth who would be aging out of foster care at 21 would be able to keep the supports they had. As you can imagine, turning 21 in the pandemic without a family to care for you would be a serious, serious problem. The final thing was that we were able to work with our DC Healthcare Finance to remove some of the barriers to telemedicine so that our children and parents could get remote mental health support. I think our families are really now in phase 2. That was really phase 1. Within the last week, I'm going to say that most, definitely not all of our parents have been able to get tablets for their children so they can participate in learning. We've been able to connect a lot of parents of infants and toddlers to early intervention supports. Because as you can imagine, some of these kids, the developmental delays they have, they're going to lose that developmental window if we don't get them speech and language therapy or occupational therapy in the next couple of months. And then I will say the thing that keeps me up at night now that we're in phase 2 is the risk of child abuse. You may have read the Washington Post story today, which we actually informed, which was really a national look at the risk of child abuse. You may have read that there have been some very serious cases in the district and around the country. The reason for that is the stress that all parents are under right now, being cooped up and not being able to get away. I think parents are now beginning to worry about the future. They've begun to get a real sense of what today looks like. And so I think that's phase 3. But before we talk about planning for the future, I'd love to take some questions from you, comments. We have such a wonderful group online. I'm sure you have lots to say and lots to ask. We don't have the capacity to easily unmute you. That's a Zoom upgrade that costs some money that we may be able to try for the next conversation. But just as a reminder, you can send your comments or your questions to Hannah via the chat button in the top right part of your screen. And
Great.
I'll stop.
Thank you, Judith. So one question we've received already is with regards to our work with asthma. So I know that CLC has done a lot of work for kids with asthma. How is the pandemic affecting them?
So excellent question. There are, I think there's 12,000 children with asthma in the district, and you may know that kids in Ward 7 and 8 are 20 times more likely to go to the hospital than kids in Ward 3. And that's almost exclusively because of the substandard housing conditions I told you about. We have been doing a couple of, so those are kids who are particularly at high risk of a negative impact if they actually get COVID-19. So those are families that can't go outside as often, they really don't want to expose their kids to anybody else. At the same time, rats and roaches and mold are a problem. And people live in very small apartments, so having a repair person come in, which is what we would normally do, now that's the risk of exposure to COVID-19 from a stranger coming into the house. We've been working with some of our allies to put together videos of ways that folks can do the most possible to clean their own homes. And we really want to keep those kids out of the emergency room right now because of the added risk to everybody about that.
Great. We have another question. How has lack of access to the courts created any challenges?
I will say one of the biggest problems is housing conditions. So normally we would be able to go to court and get a court order to abate the housing condition, and we can't do that, which is why we're using the workarounds that I just mentioned. The other big problem is permanency for kids in the foster care system. So we've got kids who should either be going home to birth parents or moving forward to adoption or guardianship, and the court has been completely closed down. We've been working with other legal service providers to get the court to open up, to have remote hearings. Those are big issues. And then I'm going to say the final area is if someone doesn't get to us, they really have no access to the court. We can file emergency motions, and we have succeeded. We did have the child and families, the kids who were removed from their home because of parental abuse. We were able to work with their grandmother to have them move smoothly into their grandmother's home and bypass foster care through emergency custody. But right now it's almost impossible to access the courts at all, and you certainly need a lawyer. So those are some of the ways.
Great, thank you. Another question, how well have the DC government agencies responded to the pandemic?
And I see Andy has a good question, which I want to answer at some point. You know, I have to say that this is new for all of us. So I have to give kudos especially to the Department of Human Services and Laura Zeilinger, who I think have really been unbelievably, they have a call every Friday with advocates. They've been extremely flexible, thinking outside the box so that everybody can keep their housing. Anybody on public benefits doesn't have to submit new paperwork. They've been terrific. Not quite as high marks for our child welfare system, which I think has been a little behind the curve. We've been pushing them hard to think about the upcoming problems. For example, testing kids coming into foster care so that they will have access to foster parents. In some ways, it's really the agencies that were doing a good job of communicating before are continuing to. The ones that were bad partners are bad partners. And then none of the schools were prepared. So most low-income kids are really being left behind right now, and definitely kids with special education needs. Any other questions, or should I take us to?
Yeah, I think we have one question that will lead well. In the next few months, what changes in the district's pandemic response and plan do you hope to see?
Why don't I answer that question by actually talking a little bit about sort of what I see as phase 3, which perhaps is an answer to that question. And phase 3 to me is, let's look forward, whether it's July or September or December, we have to begin to plan for what's next. And I know a lot of our parents are asking us about that. It took 2 years for students who were impacted by Hurricane Katrina to catch up, and to be honest, many of them didn't. Those who have really analyzed what happened during Hurricane Katrina and afterward have identified the lack of mental health support for students as a key issue why they weren't able to succeed in school. So what we want to do right away is to start a dialogue, and what I hope the city will join us in doing, bringing school leaders together with mental health professionals and parents to talk about how can we start the fall not business as usual, and how can we put social emotional learning at the forefront. I think kids are not going to learn unless we make them feel safe in school. That's what all the research shows. And obviously kids right now are not feeling safe. They shouldn't feel safe, and it's hard to make them feel safe. Also worried when we talk about going back to school, one of the things we're going to do is have some social distancing. So I think that it is going to be unnerving for children to have new rules in school, and we're going to have to spend a fair amount of time making them feel safe. So that for me is really one of the most important things. We also are going to have to address another reality. When last I checked, which was at least 10 days ago, there had been more than 2,000 evictions filed in the court system. So you may know that nobody can be evicted during the health crisis, but the minute the health crisis lifts, we are going to have literally thousands of families who might be on the streets if their evictions go through. So I think a high priority for the city is emergency rental assistance. We know from the research that when a family loses their housing and becomes homeless, it is more expensive for the city and harder for the family, for the parents to get a job and for the family to get out of homelessness. So we really need to prevent that right now, which leads me to the biggest hurdle of all, and that's the DC budget. The city has to cut $500 million out of its budget between now and September 30th. That is literally $100 million a month. And rather than enter FY21 on October 1st, the way we all expected, with a huge $250 million surplus, which we were going to spend hopefully all on kids and families, the CFO has predicted a $750 million deficit. And so we are going to need all of you to join us in advocating with the city to make those cuts as wisely as we can and to protect children and families as much as we can. And I think perhaps on that note, well, I don't want to, before I open it up for more questions, I guess I don't want to leave you on such a pessimistic note. I want to speak from my gray-haired experience. I've been doing this for more than 2 decades, and I have watched kids face, and then I will say seemingly insurmountable challenges, and come to the other side, maybe not as well as we'd like, but safer and healthier and better prepared for life. And they've done that because of their own resilience, because of their families fighting for them, because of the work of my colleagues, but also because of all of you and the work you do and our allies in the community. So I know it's going to be very hard over the next 6 months, year, 2 years, but I believe we can make it if we come together, if we support one another, if our institutions can stay standing. There are going to be sacrifices and challenges. I am not a Pollyanna, but I don't think we have a choice. So I appreciate that so many of you are here today as part of this conversation. And before we close, I'd love to have a few more questions or comments from folks, what you're seeing.
Yeah, we have a few more questions. Do you know what was behind the DCPS decision to close the schools early at the end of May instead of in June?
I don't know what it was. It was a shock to everybody. I can promise you they did not consult parents, and that parents are pretty unhappy about it. Let me just say this, I am hopeful that the reason is that they think they might be able to open earlier in August. And safety coming first, I think we all hope that they'll be able to start sooner.
Okay. Another question, who are you most worried about slipping through the cracks, and what are you at CLC doing to combat that?
Wow. The list is long about who might fall through the cracks. I think we worry most about kids who were already living in parents who had mental health problems or substance abuse problems, kids who were already at risk of being trafficked, maybe they've already been being groomed, and that we're going to lose sight of. So we are sadly feet to the ground out in the communities, visiting families when we need to. We will certainly advocate for the budget to protect the programs that are serving those kids. And I think that is probably the most important thing we can do right now.
Yeah. So we have another question, a couple that I'm grouping together.
Okay.
Can you address CLC's financial position and also how we can help? And then in addition to financial support, is there any need for pro bono support?
Great. Let me start with pro bono. Absolutely. Our pro bono program is up and strong, and I have been very impressed with the number of lawyers who've stepped up to take cases right now. So we'll put it on the screen at the end, but you can contact our pro bono director, Jen Mazzi. You can go to our website. We have lots of cases that we can place right now, especially in special education. It's a really important area. So please, we also have law firms working on a number of big research projects for us. We're very concerned about the control board coming back if we don't successfully balance our budget. I don't think any of us want Trump to appoint our overseers. And so we are doing a lot of research to support the mayor in a thoughtful budget. Where are we financially? The good news is that we, like the city, actually have a pretty good rainy day fund. We are in a good cash position right now. So I am not worried, for example, about immediate layoffs. I'm not worried about the sustainability of the organization over the long term. What I am most worried about is short-term revenue. So in the next 18 months, will our supporters be able to continue to give at the level they have been? Because if we don't do that, we're going to have to lay off staff and serve fewer kids. So we are going to be here for the long haul. We are going to weather the next few months safely with cash for payroll and rent. But over the long term, it really is going to depend on the wonderful support of those of you who've been with us for a very long time. Are there any questions, or shall we close out for now, Hannah? I don't have my eye on the clock.
Yes, we have one more question. We have seen that social services agencies are not prepared for children whose parents become unable to care for them due to COVID, parents' own illness. How can we advocate for a more robust plan for kids whose parents are unable to care for them?
It's a wonderful question. I think there are really kind of two scenarios. That is a parent who has been able to plan in advance. You know, sadly, when the current administration came into office, we had to do this for undocumented immigrants. So we had a lot of children who were US citizens, but their parents were undocumented. And we did a lot of safety planning. So we would work with parents to make a plan. Where will your child live? Let's get the power of attorney for your sister to step up. We can do that for families right now who are at risk. I think the bigger issue is for families where there aren't children available. There have already been some children who've come into foster care who were exposed because their parent died of COVID-19 and they were exposed. And we have been pushing the agency to test every child coming into care so that we can place them with a foster family safely. We've not succeeded at that. So that's a piece of advocacy that we hope that we can do soon. And of course, there are many issues that are facing our kids that aren't COVID-19 related. Remember, children still get trafficked even when there isn't the coronavirus. Kids run away, are at risk. Kids have special education needs. So we need all of your help to keep doing all of that work as we move forward. And I think that I have pretty much used up the time that I asked you to give us. So thank you for joining us. And if you'll stay with me for just a minute, let me share that we really hope to have a few more of these community conversations. Next time, we were thinking of having a school leader and a mental health professional to talk about this issue of how could we start school centering social emotional learning when school does resume. Telemedicine has become a really important issue for our families, but actually for all of us as well. So we thought some of you, especially our wonderful Washington policy wonks, would be interested in hearing about that. I'm going to send you a follow-up email to this, and I hope you're going to let me know what you'd like to hear about in the coming months. And I hope that we can make it, as we upgrade our technology, a real conversation with all of you. Thank you for joining me today. Thank you for working with us and for caring so much about the kids of the district.